Now, if you do all this, you get what I call a zone food pyramid. At the base, you're eating a lot of fruits and vegetables. You're always adding adequate but not excessive low-fat protein at every meal. Always adding monounsaturated fat like olive oil. And up to this point, the zone food pyramid looks suspiciously like the Mediterranean diet. In many ways, it's similar, except for one small difference. You cut back the use of grains and starches and make up for it by eating even more fruits and vegetables. What the zone diet is really the evolution of a good diet, the Mediterranean diet, to a higher level of hormonal control. So for that aspect, let's look at now how the zone diet stacks up, or the zone food pyramid stacks up against the USDA food pyramid. And you can see they're both pyramids. And that's where the similarities tend to stop. If I want to have an Al-Qaeda battle plan, how to destroy healthcare of America, the USDA food pyramid there would be exactly that. I can think of nothing that will accelerate the development of silent inflammation faster. And that's exactly what's happened. But that's not me talking. Let's go back to my friends at Harvard Medical School. When they looked at their databases of hundreds of thousands of health professionals and said, let's compare those who are actually following the USDA food pyramid versus those who are doing a little oddball things like eating more fruits and vegetables, more protein and less grains, kind of like the zone diet. What they found that if you actually followed this more radical approach, you'd have less chronic disease and less heart disease. Well, the other side of that question says, if you follow the U.S. government guidelines, which are being adopted by every country around the world as the way to eat, you will increase heart disease, you will increase chronic disease. And that's why we're facing healthcare reform. Why? Healthcare is out of control. Because we are basically sicker than anybody else in the world. But good news, the rest of the world is catching up as we get globalization of our food pyramid. Now, if this is too hard, if controlling your diet is too hard, you have one final defense. And this is something your grandmother told you. Take your fish oil, but a lot of it. Because I said earlier that omega-3 fatty acids found in fish oil, if used in high enough concentrations, have profound anti-inflammatory events. Now, how fish oil works, one, it dilutes out any excess toxic fat. It can also change your gene expression. It changes membrane fluidity. This is how so now the receptors for the hormones can now move around more effectively. It changes the flow of ions in and out of cells. It does a lot of things. And if you don't have enough of it in the diet, bad things will happen to you. Now let's put it all together. Some examples of how you'd use the zone diet plus high-dose fish oil. Here, what do you mean? This is my good friend Manuel. This is Manuel Uribe. Manuel is the heaviest man in the world. This is a picture of Manuel when we first started working with him when he weighed 1,230 pounds. Okay, Manuel's a big boy, no question about it. We started working with him and said, Manuel, we know what your problem is. You're inflamed. He says, you gotta be kidding. You know, what's this inflamed? But he said, we have a way that we can reduce the inflammation and shut down the hunger. He said, look at me. I've tried every diet in the world. I just get fatter and fatter. I just want to die. I said, work with us, and if we have not demonstrated significant changes in 2 weeks, call us a fraud. So we put Manuel on a strict zone diet, about 2,000 calories a day, and a lot of fish oil. Within 3 days, his hunger had disappeared, had gone. And he found it difficult to eat the 2,000 calories a day he had to. Now here's Manuel about 18 months later. As you can see, Manuel is still fat. But he's lost a lot of pounds, about 400 pounds. But let's look at Manuel's blood chemistry. There's his total cholesterol, perfect. Blood pressure, that of a teenager. Blood sugar, perfect. Heart rate, to have a trained athlete. All of you basically work very hard to maintain your physical fitness. But I'd say many of you would have a hard time matching Manuel Uribe's blood chemistry. If a doctor saw that, say, this man is as healthy as a horse. Now, the fact he weighs as much as 2 horses. but this is the disconnect. The disconnect between obesity and wellness. As I'll show in our later talks, that there is a disconnect. You can be overweight and healthy, but it's a very dangerous game to play. Now, here's Manuel on his wedding night last August, when he weighed 715 pounds. No, that's not his wife. That's one of the doctors working with him. But again, Manuel Uribe today is probably the healthiest man in Mexico. Still one of the heaviest, but one of the healthiest. One of the happiest guys you could ever meet. He's just a delightful personality. He's intelligent. He's articulate. He's very spiritual. He just lights up the room. But the fact is, he has a clear pathway to get down to his goal weight in another 5 years of about 220 pounds. But it is a drug-like precision. You take food like a drug. You eat it at the right dosage at the right time. Now, a couple of other examples of fish oil by itself. This is work done at Harvard Medical School. And what they did, they took pigs. Pigs get atherosclerotic lesions like humans. And so they took sets of pigs, both identical, and then split them, and one group got an atherogenic diet, basically your Krispy Kreme diet, rich in saturated fat, rich in cheap carbohydrates. And the other one got the same diet, but a lot of fish oil. And now after 6 months, they looked at the blood of both sets of pigs. Their total cholesterol levels, highly elevated. Their LDL cholesterol, bad cholesterol, highly elevated. Then they killed the pigs. The one set that got the atherogenic diet, no fish oil, their hearts were just all totally occluded, just like you'd say. And this proves that the Krispy Kreme diet will kill you. But the other group that had the same bad diet, the same high cholesterol levels, when they killed those pigs and looked at their arteries, they were as clean as a whistle. Why? Because we know heart disease is a disease caused by inflammation, not cholesterol. Number one drug we have today to prevent a heart attack is called an aspirin. Does it lower cholesterol? No. Does it reduce inflammation? Yes. And what about humans? This is a study taking every published data up to 2005 and looking at the effect of drugs called statins that lower cholesterol versus fish oil. And whether it be all-cause death or just death from heart disease, the fish oils were equal, if not superior, to statins. Now, how do statins work? Yes, they lower cholesterol, but unbeknownst to the drug industry, they also lower inflammation. A very expensive aspirin. And here's another study comparing what's called the Leon Diet Heart Study. This study took patients who already had a heart attack and therefore likely to get another one. And what they did, they split them into 2 groups. And one group got the recommended American Heart Association diet, and the other got a radical diet, lots more fruits and vegetables, more fish, and they took out virtually all the omega-6 fatty acids by giving them margarine. Margarine rich in trans fatty acids. So I say, well, who thought up this experiment? Dr. Mengele? This is a guarantee to kill them. Well, what happened? Those on the experimental diet, no omega-6 fatty acids, basically following the zone diet, they had a 70% reduction in fatal and non-fatal heart attacks. And you compare them to the best statin studies ever done, it's pretty remarkable. But you're looking at food as a drug. And the only thing that changed in these patients was a decrease in the amount of silent inflammation. And we also have other studies that the levels of these fatty acids, these omega-3 fatty acids in your blood, will prevent you from getting a fatal heart attack. If it's above a certain percentage, it's almost impossible to have heart disease. And what about cancer? Well, this was a patient, age 78, diagnosed with this cancer, and you can see the 2 tumors in the lung. He said, hey, I'm 78 years old, I don't plan to take chemotherapy. I'm not going to take radiation. I'm going to take a lot of fish oil. The doctor says, okay, it's your life. Well, here it is 4 years later. There's the tumors. And about a 93% shrinkage, and his blood chemistry is perfect. And what about neurological diseases like multiple sclerosis? There is no drug known to mankind that can reverse multiple sclerosis. You might slow it down, but you won't reverse it. What is multiple sclerosis? It's basically arthritis inside the central nervous system. But anti-inflammatory drugs can't get inside the brain, and good thing for us. But fish oils can. So when they gave these patients with multiple sclerosis high levels of fish oil, what happens? After 2 years, they start getting better. Unheard of. Say, that's not supposed to happen. But at high enough levels, these drugs can act as anti-inflammatory agents. And here's one study from Harvard with bipolar depression, the most difficult of all depressions to treat, giving about 10 grams of these omega-3 fatty acids per day. They had to stop the study after 3 months. It became unethical. The differences were so great, they said, we cannot continue the study. This is one study we published a few years ago with children with ADHD. It has become epidemic. So we took children with ADHD, already on their optimal drug dosage, gave them a lot of fish oil. How much? About 15 grams a day. The same amount we were giving Manuel Uribe. And what happens? Within 4 weeks, you see these dramatic changes in their behavior, coupled with a reduction of silent inflammation. The day they stop taking the fish oil, the silent inflammation goes up, and their behavior benefits all deteriorate. But probably the most interesting case occurred about 3 years ago. You might remember the Sago mine disaster on January 2006, when 13 miners went into a mine shaft and there was an explosion, and they're trapped for 41 hours in a carbon monoxide atmosphere. When they finally broke through, 12 of the 13 miners were dead. And the one they pulled out was almost dead in the rifle. There's this picture there, Randy McCoy. And when he came out of the mine, he had heart failure, kidney failure, liver failure, and brain failure. When I say brain failure, there's a picture of his brain. Virtually no white matter whatsoever. It had been destroyed by inflammation. So his chances for living were pretty slim. And if he did live, he'd probably end up being a vegetable the rest of his life. Now his neurosurgeon called me up and said, I think I should give him some omega-3 fatty acids. How much should I give him? Well, I said, I think probably about 15 grams a day. He said, whoa, 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 he's going to bleed to death. I said, he's not going to bleed to death. He says, okay. So we air-shipped out some of the omega-3 fatty acids. He started feeding him in the feeding tube. And 2 months later, he came out of his coma. And 2 months after that, he went home. And when he went home, his heart was normal, his kidney was normal, his liver was normal, and he gave a press conference worthy of any politician. And so what does the American medical press say about this? It's a medical miracle. That's the best they can say. It's a miracle. They say it was no miracle. It was an aggressive use of nutrition to reduce inflammation in every organ in his body. And if you do that, the body can basically heal itself. If you don't, it's going to end up basically not functioning very well. And there's Randy, myself, and Julian Bales, who's one of the top neurosurgeons in the country. And there's Randy's wife, who was pregnant at the time. He's since now given rise to another child, so he has 2 kids, 2 healthy kids. So everything seems to be working pretty well. The clinical benefits of high-dose fish oil are incredibly robust. This is not, vitamin C where there's no data. This is hard data, whether it be heart disease, cancer, depression, attention deficit disorder, multiple sclerosis, Alzheimer's, brain trauma, chronic pain, osteoporosis, fertility, and unfortunately back there, fat loss, like in Manuel Uribe. The data saying, how can fish oil do all these things? Because if you give enough of it, it reduces inflammation. And that's why it's as close to a miracle drug as I'll see in my lifetime.